Okay, well, good morning, everyone. Thank you for joining us on our weekly call today. We're glad to be back after a short 1-week hiatus last week. We have a very, very robust agenda today. We're going to get a vaccine update from our friends at the health department. We're going to get an update from Gary Jones at Governor Whitmer's office. I'm going to talk a little bit about the upcoming federal stimulus and what that all means for our community. I'm not going to go into a lot of detail on that today. We're going to have a speaker next week to talk about it. And then we are hoping to have State Senator Tom Barrett. He has a bit of a scheduling conflict, but we are joined by his Chief of Staff, Ron Kendall. So in case Tom is not able to make it, we're going to get a state legislative update from Ron. So I'd like to kick it off today by turning it over to Larry Johnson. Just got off the phone actually with Larry and his team talking about the vaccine situation, has some timely updates for everybody. So Larry, the floor is yours. Larry from the health department.
Can you hear me, Justin?
Yep, you're good.
Okay, good. I just got off mute. All right. Hello and good morning, everyone. Nice to be back. It's been a couple weeks since I visited with you all. Some things are changing now at the state level with regard to vaccines, and it's affecting us here at the local level. But I'll start out just kind of giving you an overview of our cases. Last week we reported out 3696 total cases. We've had 80 deaths. Last week's new case numbers week over week were 51. So we've been averaging between 40 and 60 over the last month. So we've kind of plateaued out as we've declined over the previous months. Our peak was on December 2nd, and it was 350. So we're considerably down below where we were back in the winter. Our positivity rate is at 5.5% with 112 million cases daily, 112 per million cases daily. So we'd like to get that positivity rate under 5 and ideally under 3. So we've kind of plateaued out there a little bit too, so we're watching that closely. Now, with regard to the vaccine, you know, it's been well publicized that we kind of started off slow, and the vaccine distribution to our county has not been what I feel real equitable compared to other counties, but we are starting to pick up a little bit. This week we are receiving 1,300 doses. That's first and second dose, and that's the Moderna vaccine. And so we're starting to schedule clinics for this week. Last week was a very busy week. We did 4 clinics just with the health department by ourselves. And this week we've already got 1 clinic scheduled, and right now the focus is individuals aged 50 and older with underlying conditions for a first dose clinic. Regarding the 65 and older, which is what we had been working on, we've made great progress on that list. So we've narrowed that down, but we are still getting people signing up for that list. So there's other people still in that age category that never originally got on the list. So we're dealing with that, and we're prioritizing them if they do get on. But the state now has kind of changed their trajectory of what they want to do. They're kind of getting away from these phases of 1A, 1B, 1C, and it's more just kind of opening it based on age. And so right now we're eligible individuals are 50 and older with underlying conditions, and on Monday the 22nd, it's going to be 50 and older with no underlying conditions, and 16 and older with underlying health conditions. So there's going to be a lot of people in that category. Well, then on April 5th, it's going to be all the way open. The doors are blowing off on April 5th. Everyone is eligible. So instead of allowing us to focus our efforts on targeted sectors, now everyone's eligible. And we obviously don't have enough vaccine to do everyone all at once. So it's good that everybody's going to be eligible to get the vaccine, but it really makes it a logistical nightmare for us and for our partners that are trying to, meticulously and methodically work through these lists that we've built. So I just want to reference some of the partners we've been working with, and I'm going to be sending Justin an email with our online sign-up. Many of you may have already had it and probably already have signed up, but we're getting away from phone lists because now as we move to a younger demographic, we can actually, more people have internet access. They have phones. We'll still have the ability for the elderly to sign up if they just absolutely don't have internet access. But we need to get to a more streamlined electronic way of communicating with people rather than the amount of labor it takes to call thousands upon thousands of people over 65. It's just been insane here for our department and the workload. But I want to talk about, just real briefly, mention our community partners that we've been pushing vaccine out to and working with. We've been working with Meijer and Kroger, and the pharmacies are now getting, those places are now getting some direct shipments of vaccine. Not a lot, but they're getting some. But we've pushed vaccine out to Meijer, Kroger. Memorial Healthcare is taking on a lot of the work to assist us. So a big partnership there with Memorial, and it's well publicized, they've been kind of shorted on their vaccine, so we're able to get vaccine to them. Also, Central Pharmacy is helping us, and then we've had Perry Area Fire and Rescue help us with some homebound populations where they were able to go to their site to vaccinate them. Other partners that have provided facility or logistical support: RESD, Owasso Public Schools, Knights of Columbus, Corona and Owasso EMS, MSU Extension, Shiawassee Health and Wellness, Catholic Charities, Shiawassee Council on Aging, and we just did a clinic in Durand, one of our remote clinics on what I call the road show. We're going to be able to get out to other parts of the county and not just Owasso. And then Baker College has been a partner for assisting us. And then Representative Ben Frederick has been really helpful, helping with some of these homebound people. So we're making good progress. It's still a little bit slow. More people are eligible, but we're limited by the vaccine. And then once we get into these large numbers of people being eligible, then we have to really work closely with our partners to logistically implement, getting this vaccine out. So I've got Jody DeFriend with me here from the health department. She's going to just say a few words on how we're going to communicate with you going forward, and kind of just one more thing I want to give you, just so for your numbers: 14,300 vaccines have been shipped to Shiawassee County. 19,051 doses have been administered. Now, the reason for that is people get the shot in other counties or extra draw-ups per vial. 12,980 of our residents have been fully vaccinated. That means either both doses of Pfizer, Moderna, or with a single dose Johnson & Johnson. Our target population is just under 56,000. So we're at about 23.2% of the target population. So that's some good numbers for you. I'm going to turn it over to Jody real quick.
Thank you. Before I talk about what everyone wants to know is what does this mean for me, I want to talk really quick about the homebound efforts that are kicking off. We released a press release yesterday on a number of people could go if you are truly homebound. Now, I want to separate homebound out from transportation issues. If they have transportation issues, they can continue to call our normal line, but that effort is going to kick off with beginning homebound vaccination starting next week. But we as a team, and we talked to Justin of kind of how do we move forward now. I understand we did the survey back in January of all the businesses and the interest level in vaccine. With that, we anticipated that we'd be able to continue on the path that was given to us in phases. As you know, that's not what has been handed to us, but we also are trying to devise a way that still makes sense to be able to operate with the businesses to get your people vaccinated. So one of the thoughts that we have is we have two options. One, number one, we tell everyone, get on every list that you can and take any opportunity you can for vaccine. It's not about where you get it, it's about getting it. Number two, Larry had said he's going to share with Justin to push out how you can register online individually. So our last thought was to still try to give a chance to all the employers for their employees to get vaccinated is when we hold a clinic, I have the ability to everyone that filled out a free survey to grab that point of contact email and send them the registration link for an actual upcoming clinic. Now keep in mind, we do not know until Fridays what our allocation is. So we're not even able to schedule clinics right now, weeks in advance. Literally, we learn on Friday, and then we begin to start scheduling for the next week. So I kind of leave it open, Justin. I think a good opportunity for us is when we hold a clinic, I can send it out to everyone that is on that list as a first opportunity, as long as you fit the criteria for that week. Again, April 5th, it's wide open. Keep in mind, there's a caveat to that. 16 and 17-year-olds only qualify for Pfizer. Right now, we in Memorial Healthcare are not getting Pfizer. I do think I think Kroger received Pfizer this week, so just keep that in mind as we move forward. With that, Justin, I'll just kind of leave that open-ended and give that some thought. I don't know if you guys open up for discussion, but I thought that was a kind of a fair way to give an opportunity. But keep in mind, when I send it to the point of contact, it will be the point of contact's responsibility to get the individuals either the link or to get them signed up for the clinic.
I think that's a good strategy, Jody. Before I open it up, though, I do want to give Becky Dawkey an opportunity from Memorial Healthcare to give an update from their perspective. Becky, do you want to jump in? And you'll want to unmute yourself too, if you haven't. You'll want to hit *6 on your phone. Oh.
Becky's not on the call. Oh, go ahead.
Can you hear me?
No, you're good. Go ahead. You're good.
Okay. Sorry. This week from Memorial, we received 500 doses of the Moderna vaccine from the health department. So I do want to give a huge shout out to the health department. We've worked really close with them this year, and it's working out really well. We're very appreciative of the partnership that we have with the health department. We did receive 200 doses of the Moderna vaccine from the state this week. And so we are currently having 3 clinics this week for vaccines. We have one tomorrow, one Thursday, and then one Friday. All clinics are held in the auditorium on the main campus. We encourage everybody that is looking for the vaccine to, again, like Jody said, sign up for as many lists as you can. But we are working from the health department's list right now. So we are encouraging people to dial that 989-743-2460 or fill out that online form that the health department put out, because that's the list that we are working from right now. We are not taking our own list for vaccine, people requesting the vaccine. So again, any list that you can get on, we're encouraging people to do that, but specifically that health department list. When we are calling people, it's so important that people answer their phone. We do leave a message, and there is a number that you can call back now, but it just makes it so much easier when people do answer their phone. Even if you've had the vaccine, we encourage you to answer the phone. Just let us know that you've had it so we can take you off the list, because we are going to continue to attempt to call you. Like Jody said also, we never know until Friday how many we're going to receive. It makes it really difficult to plan too far ahead, but we try to let people have as much lead time as we can before we hold those vaccine clinics. So, we are holding them later this week, but we were making our phone calls on Saturday, I believe, to get those scheduled is when we started. So we're trying to give people as much lead time as we can, but again, sometimes it's fairly short notice. So we'll continue to update. Specifically on Facebook is the best place for people to follow us for those vaccine updates. And if anybody has questions, they're more than welcome to reach out to me at the hospital.
Great. Thank you, Becky. I do want to open it up right now. If anyone has any questions regarding vaccines for either the health department or for Memorial, please hit *6 on your phone now. Anyone have any questions for the health department or Memorial on vaccines? Go ahead. Okay, well, as always, we want to thank our friends at the health department and Memorial. They're doing an amazing job. Obviously, we're still not getting enough of the vaccines, but they're definitely making do the best they can. We will absolutely continue to share those vaccine updates with you via email. definitely continue to check social media as well for those. So thank you, Larry and Jody and Becky for the updates today, and we'll definitely stay in touch with you as more updates happen. I want to now turn it over. Ron, I don't know if Tom is on yet. I don't think he is. So I'm actually going to turn it over to Gary Jones, our liaison. Gary, you're a regular. We always appreciate the time you offer to give us an update from the governor's office. What's new today?
Yeah, just got a couple things, Justin. So registration is now open for the Michigan COVID-19 vaccination clinic at Ford Field. So Michiganders can now begin registering for the COVID-19 vaccination clinic at Ford Field in Detroit. The community vaccination site is set to officially open on March 24th. The vaccine will be offered at no cost, and insurance is not required, nor will it be requested at the vaccination center. Any Michigan resident who is currently eligible to receive the vaccine under MDHHS vaccine prioritization guidance will be able to register for an appointment. This is in partnership with the Federal Emergency Management Administration, or FEMA. They will be conducting 6,000 vaccinations per day, 7 days a week for 8 weeks. So really, really great resource. I know there's a lot of states that wish they also had that resource too as well. But fortunately, Michigan was able to be a recipient of that resource. So great opportunity to get as many Michiganders vaccinated as possible. And also lastly, recently, we had approximately 810,000 Michigan children whose access to school meals has been affected by the COVID-19 pandemic have begun to receive food assistance benefits. MDHHS is automatically issuing these additional benefits now through the end of March. Monthly payments will continue through June. This is the second time that Michigan has gained federal approval of pandemic EBT benefits. Last school year, Michigan was the first state to actually qualify. During the second round of these pandemic EBT, children will receive up to $741.6 million in assistance benefits that their families can use to pay for food at stores or online. And that's everything for me, Justin.
Very good. Thank you, Gary. And I know one comment on that last item there, we want to try to get more of our restaurants signed up as well. And I think we're trying to do that as part of our efforts with the Shiawassee Family United Way, Shiawassee Family YMCA, and the Genesee Shiawassee United Way, our restaurant initiative. By the way, that is underway. We have 16 restaurants signed up. Pickup is Mondays, Wednesdays, and Friday afternoons. There's 11 different spots. I've shared that information by email. If you know anybody in need for food, please have them stop by one of those locations and pick up some food. Last thing I want to cover before I do turn it over to Ron at State Senator Barrett's office. We are going to have representatives from Senator Peters' office on the call next week. We're also waiting to hear back from Senator Stabenow and Congressman Molinar's office regarding the new stimulus package. 1.9 trillion, we all know about it, but I think what's important here is what are the specific details of that package that are going to impact Shiawassee County. I can tell you there's going to be massive impact here. I know local governments are getting funding. Some other agencies are getting funding. Just a quick list, though, to keep an eye on for our business friends. There is additional money going into Paycheck Protection Program, including some expanded eligibility. There's going to be money for a shuttered venue operators grant. So we're going to figure out what that's about, probably for some of our event centers, theaters, whatnot. There's going to be more money for the EIDL program, specifically for some of the advanced grants that some of you did get, some of you maybe not have received, but there'll be some additional grant dollars there. There's going to be $28 billion for a restaurant fund. So there's going to be grants for restaurants. We're going to figure out what that's about. And there's just more out there. So we are committed, obviously, to finding out all that's available with that program, and we'll be advising you on the details in the coming weeks. If you have questions on any of that, in the meantime, please feel free to reach out to this. But we believe it's very important. If there's money out there There's a lot of debate right now over whether or not the package was good or not, but the reality is it's done, it's passed. If the money is there, we need to make sure we get as much as we can for Shiawassee County. So with that, that's my agenda. I do want to turn it over now. I don't think Tom is on yet, so I'm going to turn it over to Chief of Staff for Senator Tom Barrett, Ron Kendall, who's going to give us a legislative update. Ron, the floor is yours. You're going to want to hit *6 on your phone.
Thanks, Justin. I appreciate the patience everyone's had, and I apologize that Senator Barrett can't be on the call. He had a family obligation this morning, taking his daughter to the doctor, so we were hopefully get on the call before session, and he still may chime in shortly, but he's en route to the Capitol. So the high points he wanted me to make sure we mentioned were, there's several articles I'm sure you guys are aware of, the money we've sent to the governor that's been vetoed. The big numbers that really became major priorities for both the Senate and the House were grant dollars to businesses to the tune of about $300 million that were vetoed, another $150 million that would have gone to the Unemployment Trust Fund to help backfill those dollars so that businesses aren't dinged again when those coffers aren't full going into next year, and then $50 million reimbursing businesses to charge licensing and inspection fees. So several people have been shut down, and the debate about the deservedness of the shutdown obviously will go on in perpetuity, but the fact that you were shut down, there's a pretty strong belief that you should not be required to pay for inspection fees and licenses for businesses you weren't allowed to operate. So that one particularly stings. We're forcing businesses to close, then charging them to be operational is completely counterintuitive, and something that the House and Senate both have really dug their heels on. The last one is another $55 million to help with unemployment taxes. These we believe are dollars that these are not. This is not an unprecedented economic downturn that the business just sometimes has to deal with in ebbs and flows. This is a government mandated shutdown that has cost people beyond just day-to-day livelihoods, but their ability to make their businesses flourish and employ the people in the community that we live and work with. So it's been horribly bad on small businesses, and we're working through the dollars that have been allocated by the feds, but making sure we're doing it responsibly. So the money that we're continuing to work with the governor's office on now are dollars that were allocated back in December. This next windfall that you'll get, hopefully a pretty good update on next week from the federal Congress leaders, is another $2 trillion into that. Of which about $10 billion comes into the state of Michigan, 5.6 specifically for the state government, and then I believe it's another like 1.6 or 1.7 for cities, and another 1.3 for counties, or those numbers might be mixed up. But I mean, it's a huge dollar figure that's going to be pumped into the state for good reason. But we're doing our due diligence to make sure those dollars are allocated properly. They're going to the best uses possible and helping to actually, help these businesses recover the way that they can and return people to gainful employment and a way of life that we're used to. So the oxygen in the room is pretty much all consumed with budget items and the struggle between what's prioritized in our side and the other. But we are working on other things as well. Senator Barrett introduced or is working on some legislation revolving around non-disclosure agreements. We had some severances with some high-level officials that have caught the eye of the media, as well as questions to our office of how this is allowed and how somebody could be dismissed and not be able to talk about their public job with high compensation numbers. So we're exploring how to best remedy that going forward, and including seeing what happened. I know that the House Oversight Committee is, I believe, officially subpoenaing former Director Gordon for how his tenure with the administration ended and what exactly corresponded between the two of them. I've not heard if the subpoena has been answered yet, but that it has going out or is going out shortly. The UIA director was another one. There's about an $86,000 severance package for someone that, frankly, did a pretty poor job. And estimates I've seen as high as $1 billion was wasted in unemployment funding. And these are things that we have to have answers for. When people call us and say, hey, I've been waiting for my check for 3 months, 6 months, 9 months. Sometimes we even had a call last week for someone waiting almost the entire year. that's unacceptable, and we have to remedy those things.
Hey, Ron, good timing. Actually, Tom just joined. So if you want to continue, or if we want to transition to Tom to jump in now, I'll let you guys figure that out.
No, I'd pretty much rather hear from the senator. So go ahead and have him.
You're doing a great job, though, Ron.
Thank you. I appreciate it.
Go ahead, Tom. You're going to want to hit *6 on your phone.
Hey, can you hear me okay?
Yep, we can hear you just fine. Thanks.
Great. Yeah, I was going to say, I agree with the last speaker there. But thank you. Thanks, Ron, for helping to provide an update. I'm driving to Lansing for a session right now. I had to take my daughter to an eye doctor appointment. She was having trouble, reading things, so they had an appointment for her this morning. And had to take her to that. Just dropped her at school, so now I'm driving to Lansing for a session today. I believe Ron covered, I wasn't able to capture all of his remarks, but I believe he covered a lot of the highlights of what we're working on, issues related to funding within the state budget, how we're going to best allocate and prioritize the federal funds that are coming into Michigan, so the priorities of those that have had real devastating and detrimental impact to them will be at the top of the list for who should be receiving some resources to help correct what happened. Ron and I were talking about this last night, and it's one thing if, the general economy or, economic circumstance or competition or any number of things cause disruption in the marketplace, but it's an entirely different situation when the government comes in and forcibly causes you to shut down or have less of an economic capability. I feel that at that point, then, the government bears some of the responsibility for the harm that was created. So that will be what we're kind of looking at. I was disappointed to see that the governor vetoed a number of things that would have, but, that's, I guess that's her, within her ability. She is the governor of the state, and she chose to veto things that would have done a lot to help some of these struggling businesses and folks who are really hurting right now. And then Ron also pointed out that we are working hard around the non-disclosure agreement issues. I feel that's been just wildly abused by this administration. The former governor, Rick commented that he could not think of a single agreement that they had in his administration that would have been anywhere close to what was offered to Director Gray or Director Gordon. Governor Whitmer's only been in office a little over 2 years and has already done this a significant number of times. We're looking at, between $250,000 and $500,000 in severance that's been paid of just agreements that we know about, many or all of which may have included non-disclosure agreements for folks who are in a public position subject to the Freedom of Information Act, why they could not disclose the significant elements of their employment, in my opinion, violates the exact point of the Freedom of Information Act. When we're using taxpayer funds and taxpayer dollars, there ought to be more accountability and openness there. So we're moving forward with that. I'm also working on correcting the Social Vulnerability Index, which is what the administration is using to hamstring and really handicap places like Shiawassee County from getting what would be an equitable share of vaccine doses. Instead of using the really obvious risk factors like age and comorbidities, they're using things like race, ethnicity, English language proficiency, what type of housing you live in, to skew the numbers in favor of communities like Detroit, frankly, at the expense of communities like where I represent in mid-Michigan, East Clinton, Shiawassee County. So Shiawassee County alone had lost, at one point, I believe, close to a third of vaccine doses that have been basically prioritized for other communities. And I think that's unfair when I have residents who are at risk. They're of the age threshold that puts them at risk. They have comorbidities that are underlying as well. It's not fair to them to say, well, this person over here may not speak English as well as you, so we're going to give them a vaccine even though they're not likely to be at risk of COVID. So those are kind of just a handful of things I'm working on. I'm not sure if I'm kind of recovering everything Ron said or not, so I apologize if I'm being a little bit redundant. Would be happy to answer any questions from folks or however you want to continue with the forum.
Thank you, Tom. And I do want to bring one thing up here because actually Ron brought this up briefly regarding the unemployment fund. I got a note recently. This is just something for you to be aware of. I got a note recently from one of our manufacturers regarding their massive increase in their premium that they have to pay. This company actually indicated to me their normal peak charge is about $10,000 a month, and normally it's much lower in the summer because they're seasonal. And their premium last month was $22,000, and they haven't laid anyone off in 18 months. So, I mean, that has taken a big bite, and that's just for a month. So that's taken a big bite out of one company's revenue and impacting, obviously, their bottom line. So anything that can be done to help these employers out, particularly ones that have not even, as you said, Tom, not been affected or not done anything on their own fault to create unemployment, but having to pay that unemployment bill, I think that's a big concern. So I just wanted to share that. Any thoughts?
Yeah, absolutely. And that's terrible. I mean, the unemployment trust fund in Michigan was built up, through a lot of sacrifice by businesses paying premiums into that trust fund over the last 10 or so years since we kind of came out of our last big economic hardship in the state. And we had one of the healthiest and robust trust funds for unemployment in the country, I believe, up until about last year. And that trust fund has just been completely ransacked and depleted. So now you're seeing premiums adjust as a simple, formula of the fact that the trust fund has been raided and depleted. And now you have employers that, again, through no fault of their own, even, and understandably, those that had to lay employees off because of the shutdown orders, they shouldn't be held to fault for this. And similarly, those that didn't have to lay employees off because they were shielded from some of the shutdown orders or what have you, it's not their fault either. So really, this was a government created disturbance in the marketplace. I guess that ultimately it was a disturbance created by the virus, but the actual economic direct effects were directed by the government. So now you're having businesses really suffer the penalties. We tried to put a large investment into the unemployment trust fund, and that was withheld by the governor. So we're trying different ways that we can to make sure that trust fund is brought back up so that those premiums in response will go back down.
Thank you, Tom. Any comments or questions from anybody? If you have anything for our state senator, please hit *6 on your phone right now. Anyone have anything for Tom? Any comments? Anyone have anything at all? Well, I think we're good then. Tom, always appreciate the check-in with you. Ron, Kendall, thank you. You did a great job too. Great update. Always appreciate you fighting for Shiawassee County in Lansing, and always appreciate your time on coming on our calls here every few months. So, as anything new comes up, please certainly let us know. You have an open invitation to participate in these weekly calls. So anybody else have anything for the good of the order? Anybody have any comments or questions before we wrap up?
Thank you again for having me. I appreciate it.
Absolutely. Thank you. Always appreciate it. Okay, well, that'll do it, everybody. Next week, we're going to have an update on the federal stimulus. You're going to want to join for that to hear about what those programs are available. So if anything comes up in the meantime, feel free to get a hold of us. Otherwise, have a good week. Thanks, everybody.